to be able to get where the PSIS is. I want to be able to get SI ligaments. And if here's the top of the pelvis, I'd like to be able to get a little bit along this ridge.
Oh, she feels that.
Glute max till about here, and then more on the vertical glute medius. Okay. Glute max does not go all the way. Okay. Let's see how the red looks on you.
Oh, great.
Yeah, red looks fine. I got everything. We good. Okay, anatomy tip. In the thoracolumbar area, right, somewhere in here. All right, where's my last rib? Okay, there's my last rib. So last rib can give you an idea of thoracolumbar junction. Also, too, interestingly enough, with the exception of one person in 15 years, your T12 is the most prominent spinous process in this thoracolumbar junction. It's noticeably bigger. So we can block that, right? I'm just feeling the interspinous space. There's one interspinous space, there's one. So we're gonna call that T12. If you wanna be sure, we can palpate the rib. That's right there, okay? Now, obviously ribs are like a three-dimensional thing. So this drawing's not gonna be, it looks kind of weird on some of the slides. And it's a floating rib, right? So it has an end, okay? T12, rib. There's another spinous process. If I just roll my finger down, there's the interspinous space. There's the next spinous process. There's the next interspinous space. There's the next spinous process. There's the next interspinous space. You don't have to be this accurate with your anatomy drawings to be able to needle in here. This is just for y'all's benefit, okay? This last one, sometimes it can trick you because this is L5. Sometimes if you come onto the sacrum, there's a bump there, and you can mistake that for like another spinous process. You can spring it, okay? Or what you can do is you can come just lateral to that and say, oh no, like there's sacrum there, you know what I'm saying? So, there we go. L1, L2, L3, L4, L5. These are the spinous processes, okay? We want to find our iliac crest. And she's got some trigger points along that. It's not uncommon to have trigger points in glute max and glute medius up there. We want to highlight our PSIS, which is where the dimples are. They're more obvious in some patients than others. Okay. And so obviously this will be our sacral base, etc. So what muscles do we got in here? All right. Yep. Let's take a look at, you guys know how we deflect out muscles? Kind of just say, I think it's in here somewhere. Can practice trying to fall off of it, right? So my paraspinal muscle bulk, kind of here-ish, okay? Someone bring me that spine model. We know quadratus lumborum runs from iliac crest onto the rib, but how do we find that guy, and how do we not needle intestines and kidneys, because that's not evidence-based, not yet, like maybe one day.
This one.
find, if you'll wrap your fingers around, just like we always do, from the side, we can come, there's muscle right there. And it's gonna be deeper than what you would think, okay? There it is, it's right there. I'm on the front of that muscle. If I go too far forward,
That's good.
there's nothing, okay? So this is one where you can clearly feel muscle there, okay? And again, like, this is a two-dimensional drawing of a three-dimensional object, but it's there. Paraspinals, what's deep to the paraspinals? Multifidus, yeah. Usually for paraspinals, we needle full depth and include the multifidus. In the quadratus lumborum, what is that guy called? My brain's
Yes,
leaking
you
out.
said it right.
In the QL, yeah, in the QL, we're gonna bracket it like that and needle lateral to medial. It's just muscle, and here's the spinous process, here's the transverse process, right? So you've just got muscle, and then you've got the backdrop of all of that, okay? And you're gonna be surprised. This doesn't really do it justice. You're gonna be surprised if we put our needle in at the end of the paraspinal muscle bulk, and then we angle it 45 degrees or 60 degrees towards the spine, how far is that needle going in? Like, we're going in like 3 inches, right? On big guys, maybe 4 inches, right? So what's gonna happen is we're gonna come to the end of the paraspinal muscle bulk. We're gonna bracket our fingers, and we're gonna angle our needle. 45 degrees is safe. If you wanna be extra safe, you can go 60 degrees. And you're just gonna needle in full depth. We don't need any downward or upward component here. You can just go straight towards that. So let's go ahead and show the paraspinals, which is also gonna give us multifidus. I like to needle the edge of paraspinals and just needle in like 45 or 60 degrees like I told you. If you wanna be extra safe, like this half is like super safe, you can just go straight, right? If you look at the paraspinal layers though, you're gonna hit more, you're gonna hit a little bit more if you do that diagonal needling, okay? And that'll guarantee that we hit multifidus, but up to you. So I usually needle. Patients can have a whole spasm of the whole thing, or they might have tender point at 1 or 2 spots, right? So if they have a tender point, hit it. Otherwise, you could just needle paraspinals once, that's good enough. Or if you wanted to do 2 or 3 spots along in there, that's fine too, okay? What I didn't draw on here, you guys need to keep in mind is that there's also what comes off of the, right, like transverse processes. Okay. So we have, that's why this is a safe zone, is because we've got transverse processes sort of like that, okay? You should do fine with this size of needle. In any of the boxes, is there longer ones like this? There should be some longer ones. I think they're in that box. I think that's our, not that box has the long ones. So if you guys want to get a long one, we'll share from that box over there. I don't think we're gonna need all of that, but we might be surprised. This is the one place in the body, maybe in the thigh, where we might need like the longer ones.
What about the glute?
Glute, yeah, glute. Okay.
That's a big one.
So again, like forget what you can see. Just gonna roll over the paraspinal muscle bulk. There it is. Okay. I'm gonna look, and I'm gonna go ahead and angle it. There's 45. We can be extra precautious and do like 60 degrees. There's a twitch. There's the bone. Okay? Are you good?
Mhm.
If you need me to take out any of the needles, if any of the needles are too intense, you just tell me and I can take it out.
Okay.
It's another reason why I don't leave needles in there. You can, it's fine, but just use the same needle and keep going, right? But for demonstration purposes, we can do one more paraspinal, and then we'll do QL. End of the paraspinal muscle bulk, about 60 degrees from the vertical. There's the bone. Is that pretty wild, y'all?
Yeah.
So we've got like 3 inches. We're like 3 inches in. So you'll be surprised, right? Especially if you're going at an angle, Pythagoras theorem, and all that stuff.
It's a negative slope.
We never escape math and physics, right? We just think man, finally physics is over. It's never over. It just follows you. Okay, so for QL, once again, I want to press onto it. If you divide the body in half, probably you're safe at the halfway line, but I might come a little bit above that. And definitely you want to feel that muscle. So if you're not feeling it, then you got to get somebody. I can feel it there. So I'm just going to bracket on that muscle. We want to go straight medial to lateral.
Oh.
And there's a bony infield. Does that surprise you guys? Like,
Yeah, it's like bigger ones.
so notice how when I'm bracketing, there's my bony infield, right? And you can, in this one, this is not a pinch, so you can let go of it. But just so you know, like you got to keep that bracket. That helps us get to the depth that we want, because that's another 2 inches of depth. That.
Oh.
Sorry.
Feels
Okay.
weird.
I'm gonna. Are you okay if I leave those in, or do you want me to take them out?
That's okay.
You want me to take them out?
Just don't squish on them anymore like this.
Okay. What else we got? SI ligament, cakewalk. If that guy's tender, y'all need to learn how to treat SI, all right? I know a guy who does a 30-hour course. It's great. So from PSIS, like just inside of that is going to be your SI joint, your SI ligament. This ligament is called the long dorsal ligament. And then we have sacrospinous ligament. And then we have sacrotuberous ligament. I don't usually needle the last two. I usually just needle this one if I do needle it. Here's what I do. Treat SI, do the MOBs, do the METs, pop it and stuff like that. If the patient's still having pain or tenderness after 2-3 sessions, then I might consider needling that ligament. Usually I don't. TJ, you do on a regular basis?
Certain
Certain
cases,
patients?
chronic especially.
And you can feel that SI ligament. It runs like this. It's a big old ligament, right? You should be able to kind of roll over it. You also have some paraspinal and some multifidus, right, tendon coming down there. So, and you just needle full depth onto the sacrum. Does that surprise you? Sacrum is not as shallow as you think. There's like some tissues there and stuff like that. So, right? Okay. Let's do one more. We can hunt around along the iliac crest for trigger points in glute max, more in this 2/3 maybe, and more in glute medius along here. And after lunch, we're gonna come and do like the whole butt cheek where we can palpate down to the greater trochanter, and maybe we'll do some needling in there. We're gonna hit glutes here. You can hit it in other places. We're gonna draw the sacrum and we're gonna draw the piriformis. Talk about where we can needle that safely. So what I'll do along this ridge is patient has pain over here. Maybe they've got like IT band syndrome or bursitis or sciatica. So we'll come and palpate along this ridge. How about you tell me which one's the worst one?
Okay. Oh. They're all bad, but the ones in the middle. all of it.
This is my
Okay.
patient's first day, and we don't want to needle like 5 spots, or at least I want to make sure we get the good ones before they chicken out or call uncle, which doesn't usually happen, but so I'll say, tell me the juiciest spot, the worst one, and then I'm just gonna bracket it and needle down until you get down halfway into the butt cheek. Like everything is a bony backdrop, okay? Until you get halfway down. So this ridge is totally fine. Needle, 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 like all of that, right? Wherever there's trigger points. So, any questions on that? We're gonna needle at least one paraspinal. Do you guys wanna have lunch first?
Mm-hmm.
Okay, we can have lunch. You just stay here while they.
It's fun.
Commit that to your memory. We'll have lunch, and then we're gonna rely on our palpation skills. If you guys want to draw, you can. I don't think it's necessary, but does that give you guys a good visual?
Yeah, I think it's already.
Excellent.
How you feel?
Not great, I mean, it's,
It's intense.
yeah.
Most people don't love it, but they love how it helps them to feel. You got a good release on like your TMJ on one side? Yeah. Cool. Anyone else have like some good, like, man, like that felt good, like anywhere in the body?
Like paraspinals yesterday.
Paraspinals yesterday.
That you did.